Today's discussion is going to be focusing on grooming of the individual. Hi, I'm Kathy Getrest, and I'm an instructor in community health. Personal grooming is particularly important to a resident's feeling of self-worth and well-being. The dignity of all human beings is directly related to grooming. Grooming includes hair care, shaving, and dressing. No matter what grooming activity is taken, encourage as much involvement by the resident as possible. The resident must be included in the process, even if participation is limited to just being able to make the choices. We'll start out by talking about hair and hair care. Hair should be combed and brushed every morning and as needed throughout the day. The purposes are many, some of which are it stimulates the circulation of the scalp, refreshes the resident. How many times have we heard the term someone having a bad hair day when seems like everything is going wrong? Generally, we feel better about ourselves when our hair looks attractive. Another purpose is that it removes lint and dust from the hair, and it helps keep the hair shiny and attractive. Some general guidelines when combing and brushing the hair. Place a towel over the pillow or around the shoulders before beginning. If the resident is wearing glasses, be sure to remove them to prevent any accidental breakage. Brush or comb the hair from the roots to the ends. To remove tangles, part the hair into sections, working one part at a time. Grasp the hair near the scalp to reduce pulling. Start combing at the end of the hair, working towards the scalp and the roots. Arrange hair in a style that a patient prefers. If the hair is long, it may need to be braided to prevent repeated tangling and snarling. Never cut an individual's hair. This task is left to a professional beautician, a family or friend of the resident, but it is not one of your responsibilities. Never place clips or bows in a resident's hair that make them look childish. And limit the use of rubber bands or clips for bedridden patients, as it can be uncomfortable when they're laying on their sides. Shampooing the hair is part of routine care. It's done weekly or as needed. For the elderly, it's more often done weekly, as elderly hair is dry and brittle and can become more so if frequent shampooing is done. Of course, with younger people, it is needing to be done more often. Shampooing may be done by a professional as well as cutting of the hair. Some facilities have beauticians that have a space right within their building. Shampooing may also be done as part of the shower or bath routine. The residents that are unable to sit in a shower may have their hair shampooed by placing a wheelchair or a stretcher next to the sink. Bedbound residents may have their hair shampooed while they are in bed. Regardless of the method used, the procedure should be done in such a way that the hair is thoroughly cleaned, the resident is not chilled. That means the hair should be towel dried or blown dry as quickly as possible after the shampoo is completed. Soap is rinsed completely from the hair, and the eyes and ears are not irritated by shampoo. It's always a good idea to check the label on the shampoo to make sure that you're using a mild soap. Now I'd like you to watch a demonstration of shampooing a resident at the sink, followed by one where the shampoo is being done in a bed.
Gather supplies. Cover the resident's eyes if necessary. Place towel around resident. Apply gloves and wet hair. Older residents do better bending head forward into the sink than backward. Apply shampoo and rub into hair with fingers to stimulate scalp. Rinse with clear, warm water. Gather supplies, place head into shampoo tray. Have one person lift head into tray and the other person wet hair using a pitcher or gallon milk jug. Cover the resident's eyes if necessary. Rub shampoo into hair and stimulate scalp with fingers. Rinse with clear, warm water. Notice how water runs out of the tray into bucket. Remove tray and dry hair.